The world does not run on headlines, it runs on people who care. I'm Peter Murphy Lewis, and this is People Worth Caring About. Alongside my co-host, Jaylene Carpenter, we sit down with the unsung heroes, caregivers, healers, helpers, the ones doing the real work, even when no one is watching. These conversations are not polished, they're personal, because behind every act of care is a story worth hearing. New episodes drop regularly. Get updates at peopleworthcaringabout.com.
My name is Jenni Torres, and I'm with the Nebraska Health Care Association. I'm the Education Service Coordinator, and this is People Worth Caring For, right?
That was perfect.
Okay.
You got it.
Yep.
All right. Jenni, let's hear about everything that you're doing at Nebraska Health Care Association. You've been here about a year, and I want the audience to know the first part of this we're going to do in English, and then we're going to do a little bit in Espanol.
Sounds good.
All right. So tell me, how's your first year been? What have you been doing?
It's been a good year. I feel I'm kind of learning more about the association as well as the industry of long-term care. So we've been doing a lot of updates in our education as well as outreach programming. So kind of connecting ourselves with schools, also with the community, especially our diverse community in Lincoln, Nebraska.
And you're in the education department.
That is correct. Yes.
What does that mean? What are you educating about?
So it's kind of more of my role is getting the students registered for classes, but along also being there for the students and also kind of supporting our instructors with any resources they might need. I also help Connie, which is our learning, one of our curriculum managers. So it is nice to be part of that because you can see our students coming in and being able to continue their journey, either where it leads them to be a CNA or higher education. It's nice to see that. So
some just for the audience, because not every state does their own training and CNA certification. Nebraska's had this training for a while, or is it new?
I think I'm not sure how long the college has been on, but since I've been there, it's been part of the NHCA. It's just like under the umbrella of it as well.
And did you become a CNA?
I am not a CNA. I don't have any much background in long-term care. Most of my background has been working in the community with our diverse community and being in the school system.
How hard was it for you to learn long-term care, all the acronyms, all the abbreviations, all the health terms?
I'm still learning them. Yeah, it's kind of, sometimes it takes me a while, but I have really good support and a lot of a good team that helps me along. So, yes.
What has been the best part of your first year?
Best part of my first year is kind of learning about our Spanish manual that we have. So trying to get out there and promoting that more to the community itself. So and being more in the outreach. I love being in the community. So being able to still continue to do that has been great.
So what do you mean outreach? Are you going to high schools? Are you speaking at community colleges? What are you doing?
Yeah, so we're going to career fairs or like education affairs. Like we've gone to schools to do that as well. We're going to the Latino Festival in September here in Lincoln. So kind of getting that information, connecting with other agencies. We currently have a partnership with Lincoln Literacy, so kind of continuing that with them. So
what are your goals? Do you have a certain amount of students that you want to enroll?
I don't have a certain amount of students. I just want to be able to know that if they are not able to pass the first time their class, that they're willing to come back and give it a try. So just being able to continue to support them on their goals.
Do you have any stories that have inspired you of students that you got to enroll and they've, got through it and they got a job and they were excited?
Yeah, so we do have a couple of students. I would say it's mostly our students that English is not their first language, just kind of seeing that they're willing to give this a try, even though maybe some of the medical terms might be a little bit different to their own language. But just, sometimes, unfortunately, sometimes they don't pass the first time, but just knowing that they're calling us back to be able to come back and retake the class and actually passing it the second time, it's just amazing to see how determined they are and how willing to adapt to like new changes and a new world that they might not be familiar to. So.
Lovely. Let's well, congratulations on your first year. Let's transition into Espanol.
Okay, está bien.
Cuéntame un poco cómo fue el proceso de aprender de long-term care en Estados Unidos en el primer año acá trabajando en la Asociación de Nebraska.
Yeah, so sigo continuando aprendiendo más sobre la industria. No tengo mucho, pero mi equipo me ayuda, mi equipo que es en mi grupo o mi agencia me ayuda a aprender más y como maneras de seguir aprendiendo y tener nuevas ideas para continuar eso.
¿Qué porcentaje de los alumnos que están estudiando bajo tu programa acá en Nebraska para ser como asistentes de enfermeras, qué porcentaje de ellos hablan español?
No, en este momento no tenemos una manera de saber cuál es su idioma primero, pero usualmente sabemos si vienen como de una agencia o comunicando. So, diría como un 20% a lo mejor, no español exactamente, pero otros idiomas.
¿Y a qué te dedicabas tú profesionalmente antes de ese trabajo?
Yeah, so yo he trabajado mucho en las comunidades. So, trabajé antes, he trabajado con la salud mental, con la comunidad hispana y también he ayudado en las escuelas, ayudar a padres a aprender inglés y luego hacer eventos para los niños en las escuelas que los padres puedan ser parte de.
¿Y qué consejo o qué palabras de recomendación compartirías con un joven, no sé, 18 años, 20 años, que no sabe qué hacer y de la oportunidad que tiene contigo en tu programa de educación?
Yo les diría que tomará su tiempo. Todo no va a salir todo a la manera la primera vez, pero tomando los pasos, teniendo el corazón de hacer algo, porque a veces lo hacemos más porque decimos, oh, haremos una manera rápido de tener un trabajo, pero si no tienes la pasión o el corazón, no va a funcionar y te vas a desesperar y vas a buscar otro lugar donde ir y a lo mejor no es el destino. O sea, siempre tomar calma, paciencia, saber cómo tú mismo, tus habilidades y tener valor de crecer en esas técnicas.
A mí me gustaría sumar a eso que si tú fuiste criado con tu abuelo o tu abuelo y te gusta acompañarlos, te gusta escuchar, tú tienes esa paciencia y no sabes que si lo puedes hacer en inglés, acércate a una casa de ancianos y sea voluntario por un fin de semana. Probablemente la persona encargada de esa casa de ancianos va a buscar algo donde acompaña tus fortalezas y al mismo tiempo te va a dar cuenta muy rápido si tú eres capaz o tienes la capacidad de cuidar y amar a ancianos que no son de tu sangre, no son de tu familia y rápidamente vas a saber. Y te necesitamos. Yo estudié para ser asistente de enfermero a los 41 años y si lo puedo hacer yo, lo puedes hacer tú.
Sí, exactamente.
Sí.
Y yo pienso que a veces bueno, en algunas culturas es un poco diferente porque no todos conocemos un hogar de ancianos. Usualmente nosotros cuidamos a nuestros familiares en casa pero a veces no sabemos qué recursos en la comunidad que te pueden ayudar. No tienes que saber todo a tú mismo porque a veces uno dice, ok, esta manera podemos cuidarlo, pero si no tienes el entrenamiento que te pueda ayudar y ayudar a la persona que estás ayudando, es muy bueno saber los recursos que hay, porque yo mi cultura, pues con mis papás, mis abuelos se quedan en casa, mi abuelito no tenemos el miedo de llevarlo a un lugar, pero también no sabemos qué tan la cultura van a tener. So, tener entrenamiento es lo más importante también, porque sabes cómo cuidarlos, cómo darles el mejor lugar y cómo seguir queriéndolos como dices. Sí.
Bueno, muchas gracias Jenny por acompañarnos y bueno, si alguien está interesado, puedes ver en YouTube, hay un documental que hicimos yo junto con Nebraska Health Care Association, que se llama People Worth Caring About y lo puedes ver cómo es la vida.
Sí.
Y si tienes miedo, no dudes en escribirme a mí ni a Jenny y podemos hablar contigo para que hagas todas tus preguntas.
Sí, por supuesto.
Muchas gracias.
Gracias.
That's a wrap on People Worth Caring About, born from the documentary Built to Keep the Stories Going. Shout out to Nebraska Health Care Association and Jaylene Carpenter for helping launch it, and to Ohio and New Mexico for making future seasons real. Watch the docuseries online or at peopleworthcaringabout.com. And if this episode meant something to you, leave a review. It matters. Take care of yourself and the people worth caring about.